Welcome, everybody. This is the very first event in this series, Digital Health Africa, Partnerships and Networking. And I think this is the very first time we've done this event. It's not going to be the last time. We're starting something. And maybe not everyone knows this because on LinkedIn it says this event's for 1 hour. And it is. But we are going to have spotlights with all the speakers. By the way, if you have any questions, put them in the chat. Don't wait. Put them in the chat. And then, so each speaker is going to be on one at a time. And then we're going to have all the speakers on the screen for the last 15 minutes, answering questions as we go. And then we're going to have an after party where everybody in the audience, they can turn their cameras on, they can turn the microphones on, and everybody can mix and network and meet each other, and everybody gets a chance to speak. So my name's Jose Garcia, but I'm not the only host. My fellow host, Antonia. Hello, Antonia. Thank you so much.
Hi, everyone.
And how are you feeling? Have you ever hosted a webinar before, Antonia?
Oh, yes, I have. I've hosted a lot of webinars as someone who used to be the chief administrator of Physiomentalis. So I'm very excited to be doing this again.
Do you mind introducing yourself to the audience? A little bit about your background. Because I know a lot of you may know Antonia from LinkedIn and your posts, but some people here don't know you. So I'm wondering if you can introduce yourself. You mind?
Okay. So hi, everyone. My name is Antonia Abraham. I'm a lot of things. I'm a physiotherapist. I'm a AI ethics and literacy enthusiast. I'm a health content specialist. I'm an all-rounder person. And I work in Physiomentalis. I'm currently a WHO FITIS member. I could go on and on about a lot of things I'm doing, but I'm mostly for health and in health. So it's a great opportunity to be here to not just advocate for digital health, but introducing a space for Africans by Africans. So it's lovely to be here.
Good to have you too.
Okay, we're going to bring on our first speaker. Samuel, ready or not, we're bringing you on. And the first speaker, the vision, the big picture vision. Samuel's a big picture vision man. And I always like to start every event with the big picture, the vision. And I'm wondering I remember if you could start, because this is you're the very first speaker, the very first event. What do we want to achieve here? What do we want to achieve here today in terms of promoting networking and promoting partnerships in African digital health?
No. I'm sorry, was that question?
It's for Samuel. Sorry, that question is for you,
up.
Samuel.
Oh my God. Thank you so very much. Thank you so very much. My name is Samuel Daniel, a science-backed content strategist focused on transforming how we communicate health and wellness innovation. I help health tech startups, wellness brands, and pharma companies simplifying complex science into clear SEO-driven content that builds trust, attracts users, and drives growth. However, after this event, I want to believe that this event is going to take me to the next level. because I'm looking at the big picture. It is a privilege to be here. And by the grace of God, I want to believe that this event will not leave Africa the way it is right now. That in no future time, Africa will have reasons to smile again, because a lot of things that has to do with healthcare in Africa will be fixed over time. And I never thought I would be the first speaker, but I know that events of this nature will always bring great things to the continent of Africa. I will beg that you bring in the question again. Thank you.
Thank you, Samuel. And thank you, everybody. We got people from joining from all over the world. Like this sounds in the chat. And I know you've spoken a lot in well, actually, I'm going to back up a bit, because Chenayi shared some posts with us in the group chat, and there's been a lot of conferences this year. There's a lot of talk about a desire, not just a desire, an imperative for Africa to build its own digital health solutions, to build its own AI, to implement them.
That's right.
And a lot of people, I mean, people ask, where does Africa has fintech unicorns? And some people have said Africa needs a health tech unicorn. Is that the right way to think about it? That it needs to be a unicorn? Or would you say that's almost like an end goal? What do you want to see happen this year?
All right. Let me just start by saying that when I say we, I'm talking about the African continent, that we carry 24% of global disease burden. We have just 3% of the world's health workforce and 1% of its financial resources. But here is the twist. Africa is not waiting to be served. From the M-Pesa in Kenya to zip lines, blood delivery drones in Rwanda, and mobile first innovations in Nigeria that I come from, we are seeing sparks of brilliance in every corner of the continent. So the rhetoric question isn't whether we have the potential. The question is, how do we unlock it together? My vision for Africa is how to unlock the potential, the numerous potentials that are available in the continent of Africa. And I want to believe that that's why I'm here, that's why we are here. Not just to talk about apps and gadgets, but to build partnership, to stop working in silos, to co-create solutions that are first local, scalable, and sustainable. Creating solutions that are local, scalable, and sustainable together. And I want to talk about, in that perspective, two big ideas today that show how we can do just that. Part one, bridging the rural-urban divide that is in the continent of Africa. One text message at a time. Let's start with Nigeria, for instance. Over 72% of Nigerians live in rural areas, but only 20% of health facilities are found there. Even worse, a rural mother is 3 times more likely to die during childbirth than her urban counterpart. Why? Number one, distance. 2, poor roads. no power, and yes, the digital gap. In rural Nigeria, only 36% have internet access compared to 72% in cities. But we don't need billion-dollar gadgets to change that. Sometimes all it takes is just a text message. A text message. Take Smart Health in Nigeria, for example. They send free SMS alert on antenatal care to over 500,000 rural women. The result being that a 30% increase in clinic visits. And it works because SMS doesn't need data. It works on any phone. And it costs less than a bottle of pure water, less than 10 naira. Or look at MDoc using USSD codes like 347 hash to connect farmers in Sokoto state in Nigeria to doctors in Lagos via voice call. That is digital health for the people, not fancy, but functional. Now, the part two that I want us to consider is the power of culture in community-driven health tech. The power of culture in community-driven health tech. The power of culture in community-driven health tech. Let me shift gears. We often say that Africa is mobile first. I beg to differ. We are trust first. In many Nigerian communities, if your village chemist doesn't trust your app, nothing will. If a Nigerian chemist doesn't trust your app, neither will anybody else. If an imam doesn't trust your app, if a pastor that is controlling a good number of congregation doesn't trust your app, nobody will. That's why platforms like Kampe are winning. They offer consultations in Hausa, Yoruba, Igbo, Pidgin English, not just English. They partner with midwives and local chemists, not just influencers. And they work on basic phones, no internet needed. Because tech without trust is a non-starter. Same goes for mobile for maternal health. Inspired by South Africa's Connect. They send weekly health tips via SMS, including proverbs and birth plans shared with in-laws. Why? Because in many households, mothers-in-laws and husbands make the final decisions. What am I really saying? Cultural context isn't a barrier. It is a blueprint. Cultural context is not a barrier. In Africa, it is a blueprint because you can't take that away from the people. People that doesn't have a culture doesn't have a future. So cultural context must be harnessed into whatever thing that has to do with, whatever solution that has to do with health. And when we design with that in mind, we live to save life. What is holding us back is another rhetoric question that I want us to consider. What is holding us back? We all know the barrier. Number one, 80% of rural clinics still don't have reliable power. Two, data costs are too high. It is a luxury. Many health workers still struggle with basic digital skills. But here is the good news. The opportunities are bigger than the problems that we are seeing in Nigeria, in Africa as a whole. Number one, solar-powered kits are now diagnosing diabetes in rural Kogi State as we speak right now. Live banks cold storage plus motorbike apps reduce blood waste by 70%. And Bamingo is training aunties to use tablets for prenatal care because people trust people more than platforms. People live to trust people in Africa more than platforms. So what is next? Three things. Invest in hybrid tech. 2, design for culture. 3, build coalition. Invest in hybrid tech. What I mean there is that you mix high-end AI with low-tech SMS and USSD. 2, design for culture. Whatever solution that we are bringing in Africa must speak the language of Africa. Respect traditions and meet people where they are. 3, build coalitions. Startups, telcos, government, donors. We can't do this alone. Because when a woman in Kano State dials 347 ash to save her children from malaria, or a midwife in Osun State diagnoses a high-risk pregnancy using solar-powered ultrasound, that is digital health Africa. That is dignity. That is access. That is hope. And that is exactly why partnership and networking aren't optional. They are the oxygen. Partnership, networking, they are not optional. We must look for a way to partner in order to bring the solutions that Africa needs in health tech. That is my take for now. Thank you so
very
much for
much.
having me.
Thank you very much, Sameul. I'm going to bring you back on at the end, and Sameul will also be speaking in the after party. Thank you very much, Sameul, for that.
Thank you. I'm grateful.
Chenayi, are you here?
Hello. Hello. My apologies. I'm having a bit of a strange one today. We're here talking about health, and my health is not exactly perfect. So
Let's see.
that's the irony of the day.
And well, thank you so much for coming.
It's all right. That's my pleasure. But I will not be staying long, unfortunately. I would have loved to really stay and participate for longer, but as you know, I'm not able to do so today.
I appreciate it. We appreciate you coming. And you know,
shall I get my camera on?
Yeah.
Okay.
I'll bring you on. I'll bring you on.
Okay.
And let's see if I can make you. Let's see. I don't see you. And I wonder if you can introduce yourself. I'm going to try and bring you on, Chenayi.
Okay.
Oh, there you are.
Can you see me now? Yeah.
Everyone can see you now.
Yeah, good.
And I wonder, you were at a conference recently and you were sharing some information with us about it. I wonder if you can give us a big picture, because I know there is a lot of talk about Africa developing its own health AI and what that looks like and what the concerns are and what the drivers are. I wonder if would you be able to speak to that?
Sure. I think what I definitely want to be able to do, Yosef, that's okay, is to almost present what I call sort of the problem statement, right? Why this conversation matters and conversations like this matter, and why partnership in terms of digitalizing healthcare in Africa is absolutely important. And this is not just a problem for Africa. It is a problem that needs really to be addressed. To be looked at as a global problem. And why do I say that? So the reason I say that is a threefold. I don't know if you can hear me.
Yes, we can hear you.
Can you? Okay. So for me, the problem
Yes.
is threefold. One of the things that was highlighted at the summit that you speak to, which was the Kigali Global AI Africa Summit, was that a really important statistic I picked up, that 1% of data that is used for large language commercial models, only 1% of that data is African data. It's data about Africa, African people, African environments. It's only 1%. And then that is also even more shocking when coupled with the fact that apparently 80% of African data does not reside in Africa. So that already puts Africa at a disadvantage in terms of actually having the knowledge, the intelligence to be able to make good strategic decisions for Africa and for African people. But the other issue I discovered myself recently, so about half a year ago, I had the unfortunate experience of breaking my ankle, and I talk about this a lot. So I broke my ankle whilst I was out walking somewhere. And whilst when it happened, I thought, right, I'll quickly go on the internet and find out if I've definitely broken my ankle. Is it just a sprain? And so I said, I mean, will you take, have I broken my ankle? And so it started asking me questions like, is there any discoloration? Are you showing signs, any purple, any green? And I'm thinking, right, okay, no, a little shiny, but I can never be purple. And that really put in my face the very fact that in terms of health data, even simple, just symptoms, we don't have enough information about Black skin, we don't have enough diverse data to be able to use it in a useful manner we're speaking to non-white individuals. And of course, this is where Africa, then for me, and diversity and AI and diversity became really, really important because, and up until that point, it really just hadn't quite hit me in the face. And I think since then, I've just really been interested in understanding where are the gaps and what really is happening with data. So with that, I would say this is the big problem that we have. If we do not have enough information, the gaps will be felt in terms of in the pharmaceutical industry specifically, in terms of really even having that predictive intelligence that enables governments and policymakers to really create more resilient infrastructure in the health sector, to really be a bit more strategic and forward thinking, which is where other countries are able, other continents rather, should I say, are able to get that information and make better decisions. So, and also in terms of product development, whether you're looking at the beauty industry, whether it's the health industry, and really that type of product development, it benefits everybody. It's not just an African problem. When you're trying to work on or any I'm sure any scientist will tell you, when you're trying to work on research and product development, that the more information, the more varied that information that you hold is, the better the product. So it's become really, I think, quite critical at this juncture to create systems that promote the digitalization of healthcare and the healthcare data in Africa. But also that off the back of that is a problem, or a secondary problem, or is it perhaps primary, depending on how you look at it, which is the governance and the regularization that should then come with data, because we know that data should also be viewed in itself as an economic asset, right? So if we're saying at the moment we have a lot of tech startups that are coming up and they're saying, right, we've got this innovation that's going to help in terms of digitalizing the healthcare industry, but the data that will be collected will be so useful that it's important that those partnerships start coming up now, right at the start. They really get the investment so that we create an ecosystem around healthcare data that is for Africa by Africa, So we move away from that, from the existing models where 80% of African data is not held in Africa, and we start to inform the language models better. I mean, 1% is quite damning, because when you think about, yes, 1% of African data, but that has an impact in terms of diversity, whether we're looking at the Black population, whether that's in America or the UK or wherever. It just means that there's not enough information when it comes to diverse data. So I would say that looking at it from a policy perspective, let's work on an ecosystem that promotes the collection and the use of data, but also that comes up with the right governance frameworks around it, because data in itself is an economic asset, right? We don't necessarily want to be in a situation where, because it's now widely available, the economic value of it is lost. So we need to really think about how the governance can be viewed, and I don't think it should be looked at a country by country perspective, but we should actually start to look at Africa as a jurisdiction in itself, right? Because that's where the benefits really then start to come in. There was a debate I was listening to earlier where they were saying, okay, so do we then, because we're saying we're not collecting data, we are moving now to creating data centers that will then power AI capability. And I think we've had something like 700 data centers across Africa, which in itself I think will become problematic, right? Africa we're just not big enough to really work in that level of silo, but perhaps having a more regional outlook that then moves to a more continental outlook, and really thinking about how we then promote the use of data and within those kinds of framework or ecosystems. So I think those are kind of my key highlights in terms of healthcare and data and the diversity thereof, and why it's an everybody problem. It's not just an African problem. I think there must be a concerted effort in promoting innovation around healthcare digitalization in Africa, especially because we are also quite a bit behind, but with AI capability, really we can leap. It's the opportunities for Africa are vast. We talk of being able to run before we can walk, but if with AI capability, we can actually leap before we can walk. And so this is why I think this is a very, very important conversation that we need to continue having until such a point where a solution is found and is in place, is implemented, and we are all thriving, whether we're looking at the healthcare sector or is the agriculture sector. I liked what the previous speaker was talking about, solar. And yes, I think when we now look at the infrastructure, because if we are going to be talking about healthcare digitalization, it means that we need, whether you're in rural Africa or urban Africa, you need to have the same level of access in terms of healthcare digital platforms. And to be able to do that, there then becomes a requirement in terms of infrastructure. And I think this is where, if we look at our own infrastructure devices that are powered by our natural resources, such as solar, that will increase accessibility. So I think, I just want to buttress the point that was made by the previous speaker as well, to say we should consider, when we're looking at infrastructure, looking at solutions for Africa that are also based on our own natural resources as well. I think I'll pause there for now.
Thank you so much. And I'll go to Antonia for a question. But before we do, I just want to say the word infrastructure comes up a lot. Antonia, did you have a follow-up question you want to ask?
I certainly do. First off, I think it's similar to having a house first, just because have articulated basically what it would take to make Africa stand its own when it comes to digital health. I think as a young person and someone who is a health professional, it's very obvious that the industry in Africa has to deal more with the resources and how those resources should so it's beautifully said how to speak to that space. I guess my question would be more for people that would want to make the change but don't know how. We're so lucky to have these two speakers that are well versed in experience. And my first question would be overcoming the barrier of thought. Yes, there's a lot of culture involved, there's a lot of sites, or rather imagination, needed to make Africa a bright place when it comes to digital health. So what would both speakers offer in terms of how young people or just people interested in digital health in Africa can start to make these changes? What are the little things they can do? Yeah.
Okay, I think if that question is for me, I would say we need to stop waiting to be invited to the table and actually create the table. This is the thing that happens with technology. Technology is not, the environment that we're in now. We are not no longer sensitive to necessarily experience or even a lot of financial resource. You have an idea. What's the first best thing that you can do with the resources that you have where you are? We need to move to a mindset of actually creating the table rather than being waiting to get invited, because parts of the world have really moved on, and if young people in Africa are coming up with innovation that is suitable for Africa's requirements, then in the first instance is actually that having that movement of young people that can come together and work together and create the table for themselves initially before then approaching a different table or being invited to different tables. Then the other thing that I was going to say as well is we also need to start promoting local solutions, where we're looking, especially in this healthcare space. When I was out in Kigali, I met quite a few young people, young Africans that have come up with innovative solutions. And I've been doing my best in my small space to promote the solutions that they've come up with. So we also need an Africa First strategy when it comes to healthcare solutions or whatever sector solutions that we're looking at, and then improve from there. Because otherwise, we are constantly going to be relying on the innovative solutions of elsewhere. So we really need an Africa First approach that promotes local solutions, but we also need young people to come together and really create their own innovative spaces and tables, and because I really think that having that capacity to come up with your own ideas to address your own solutions, I think that is something that it must be marveled and protected.
I do think that is the most useful answer to that. The question was for both speakers, so I don't know if Samuel is still.
We're going to have to bring
here
on the next speaker, Antonia.
Oh yeah, definitely, yes. But thank you so
much
much for your answer.
We're going to bring on one of the young digital health innovators now. Joseph, ready or not, here you come. And I met Joseph about a year ago, and it was actually me and him talking last summer. We had the first idea for this. And actually, and it was actually, and I was also really impressed with your community-led approach to digital health development. And this is Joseph, founder of Serene Mind, a digital health community. Well, you've got a community on X.
Yeah.
But you're not just a community. You're providing mental health services and support digitally.
Yeah.
And I wonder if you can introduce yourself a bit more and also talk to us about community-led development.
Okay. Thank you very much for that introduction, Jose. Hello, everyone. My name is Joseph Katimbo. I am the founder of Serene Mind. Serene Mind is a health tech startup focused on providing borderless mental health care across the African continent. Back to Jose's question, most of the work we do at Serene is community-led. There's a philosophy that I'm not sure who came up with this philosophy, so I won't misquote them, but it says solutions work best when they're built with the people, not just for them. At Serene Mind, this meant designing mental health systems that were not just technically sound, but relevant to the African culture, locally accessible and community-driven. We were able to start this process of community-led development through observation. As we're developing our mobile platform, I kept on talking to different therapists about what challenges they face and what they would require to use this platform for their work. And I kept on getting different answers, but a few of them were the same solutions. So then I went back to the development team and I gave them the bad news that we had been building the wrong platform. We had to now sit down and rebuild the platform from scratch, but having these therapists on board where I would go maybe a week's work and ask, okay, how would this help you? What do you think of this feature? What do you think of this? This enables us to understand that mental health in Africa was still very heavily stigmatized, and many of the services were limited by geography, language, belief systems, and the lack of digital access. So why does community-led development matter? Through our process with Serene Mind, we learned that technology alone does not create trust or change behavior. The voice of the community does. A particular example we had for Serene Mind was understanding the onboarding processes that the therapists went through with their clients, and what would be interesting for a client that has just started their therapy journey. What steps should we cut out to make sure the process is very efficient, and how what other features can we include for someone that needs, that's in a psychological crisis and needs urgent help. Also, this meant partnering with other local champions in mental health, faith leaders, and therapists who understood and had experience working in these different African contexts. And through this, we're able to launch X Spaces, where we now, every 2 weeks, I think, we have different people come and share their lived mental health experiences. Now, this has become the first point of interaction with our platform, because there's many people that, yes, hear about Serene Mind, and yes, they have tried solutions out there, but they're not sure if they want to start. So these conversations enable them to, one, get mental health awareness of what Serene Mind is doing, yes, but also the different issues around mental health, etc. Yeah. Then two, it also enables them to understand and interact more with our brand. Three, they get to talk to some of our specialists that are presenting on the platform, and then for themselves, they're able to decide if they're interested in talking to this therapist about whatever issue they have, or with someone else. So using this process, I'll call it a process, we were able to have engaged communities that enabled us to define what a safe place for mental health activities would be, and what that entails, giving us a view from the client side, which is the patient receiving the services, and the therapist side, which is the person providing the services. Because we came with our engineering perspective, you know how engineers will just come in and think, oh, they can solve everything. But we have learned it's not how it works. You have to work with all these people. So how do we scale this mindset? You might ask, Jose. I would suggest, number one, we invest in the local expertise early. Just like the previous speaker has mentioned, that of all the partnerships, now would be the best time to start, as these companies are still young, because once we have a unified ecosystem, it enables us to grow together and expand into the different regions, into the different African markets, because the African market is a very big one, and there's a lot of challenges, which when we work together, we are able to solve them at a much faster, cheaper, and faster rate. Now, I understand this is not the model that's normally used by Silicon Valley of build, but it's much more sustainable, because you want to build something. Now, I'm not criticizing them or anything, but you want to build something that resonates, yes, with the population, but also they can use, because very many of the people I've talked to, they have had products they have used, and maybe they got burnt by the products were not what they said they would be, or they worked with a different product that was excellent, but then the product didn't optimize for safe growth. It optimized for just growing and growing and growing, which killed their quality and took them out of business. So the second point should be, in my opinion, redefining success. Maybe I've touched a bit on it before, but that would look like, instead of tracking just user acquisition, like how many people have downloaded the app, we can track trust moments. That's something we are working on actually at Serene Mind, where we kind of track how often a user refers us. Because if we get, for example, Jose, and he uses the Serene Mind platform today and gets quality of service that he wants, he's able to tell the rest of his family, he's able to tell people he works with. And just like that, we have slowly got someone that's promoting us to other people without us having to spend ads to reach these other people. And I bet we can all agree that brands where we have talked, where someone has told you about, or I'm not sure if the brands use, but for example, if someone says, oh, iPhone has good cameras, and you're in the influencer space, you will obviously go and buy an iPhone. It works much faster than just seeing an ad for iPhone. And then lastly, I believe we should build coalitions, not just products. Digital health will thrive in Africa when it works across networks. For example, clinicians, community members, spiritual leaders, storytellers, etc. We don't need silos, we need ecosystems. As I conclude, if Serene Mind has taught us anything, it is this: the people already know what they need. The future of the African digital health is already written by the communities. We just have to build the pen. Thank you very much. Over to you, Jose.
Thank you, Joseph. We're going to bring Joseph back for the after party. Thank you. Now we're bringing on, we might go a little bit over time, everyone, just warning you. I'm going to bring on, let's see if I can make Mories. Let's see, I'm going to ask her to unmute. Mories, are you there?
Yeah, absolutely, Jose. How are you?
I'm very
afternoon,
good.
everyone.
Thank you so much
Yeah.
for coming.
Thank you for having me. I must apologize. I'm right at the hospital now, so I won't be able to get on my camera. But just let me share my thoughts. I've actually been listening to all the very valuable insights also shared. Can you hear me?
Yes, we can hear you. We hear you really good.
Okay, perfect. Now, these are my thoughts, and I've, paid a bit of attention. I see that we're talking to a lot of issues and, challenges. I want to start with the good news. What is working for Africa as far as tech is concerned? The first thing, from my point of view, is that we're the youngest population. We have the highest youngest population in the world, and that's a big deal. That means that we have a lot of people at the age bracket between, say, their teen years and in their 30s that are willing to challenge themselves, get creative, be innovative, and make mistakes as far as all this, tech and the journey is concerned. Now, having said that, it's also to not shy away from the reality of what we're dealing with continent. And I say that reality, with a lot of sensitivity, because as a continent, we're at a significant moment in transforming our healthcare systems through digital innovation. And we can feel the buzz, even though it doesn't seem, we've got it all together, but it's there. And it's coincidentally, this is the generation that is pioneering that movement. From telemedicine to AI-powered diagnostics, digital health solutions, emerging across the continent. Now, to achieve scale, to be sustainable in what we do, and to be impactful, The solutions need to be embedded within strong partnerships. And I hear the previous speaker talk about moving away from silos and being collaborative. The partnerships need to be deliberate and they need to be really grounded. And the partnerships need to be supported by vibrant networking ecosystems. Now, you say you can ask, what I mean by that. If you agree with me, we're dealing with a unique situation where we have really smart tech young generations now having to interact or play in a space that organically or originally they really, didn't have any business around. A lot of the guys who, go into the AI and all of the other health tech and digital and non-digital space were not originally health experts. And so they find themselves wanting to, explore the health space. We need to be deliberate about our multi-sectoral engagements and partnerships. We need to be conscious about bringing down the walls. Now, the health space is not an easy space to navigate if you're not a health-focused person. I've been there, and I know that it wasn't particularly simple to penetrate. But you see, Africa cannot afford that luxury of working in silos. We need to be deliberate about the integration and the collaboration. Now, again, let's talk about what we must do to accelerate progress in our digital health journey. I'd mentioned the case for partnerships with the reality that no single institution can ever drive digital health transformation by itself. The partnerships have to happen between governments, between tech companies, between healthcare providers, between funders and development organizations. And these collaborations will support in really just demystifying the entire system as its body. It will break silos, will help to align resources, and also ensure that innovations are not only implemented, but scaled and sustainable. Another point is, and this is, we're talking Africa, which is a good thing. So we're talking across borders. We must leverage this cross-border collaborations for regional impact. We must be at the front of pioneering and of driving cross-border breaking of barriers. Now, the good thing is that we can do a lot of things virtually. So we're not inundated and we're not slowed down by the traditional in-person movement around when it comes to tech. Those are the spots where we need to thrive and drive hard. Those are the areas where we can actually record a lot of successes. Innovation thrives in ecosystems that foster connection. We can connect without moving. Networking, and I'm happy you say you're doing this. It helps us and it helps digital health innovators to access mentors, to access funding and partnerships, and of course, technical expertise. Imagine that the 750 people who registered for this event, because I actually checked recently and I saw quite a number, become a community. So we've started something, and we know that we're all linked by the interest of digital health or health tech. Imagine that we start a community and everyone has the opportunity to decide by knowing what another person does, you can decide who you want to have strategic partnerships with because of the need in the market. And so this becomes really pivotal as far as I know, and I know you say you can do a lot with what you already have in your hands. So events like hackathons, pitch competitions, and digital health conferences are powerful platforms for catalyzing these connections. And I don't know if you know, but we also we're launching something called Accelerator Pitch. It's also about harnessing this massive market. We're going across universities in Nigeria. We're going across startups, that are focused in this space. And it's about just really harnessing all of this creativity and innovation and giving them the opportunity to showcase their works to potential investors and funders. I'm also going to talk about human capital and strengthening human capital through collaborative capacity building. You know, I mentioned about the power of multi-sectoral engagements and partnerships. We're not doing that well enough. It's almost as if we believe that, you know, if we can do it behind the scene, you know, just get somebody who is going to help fix the tech component. It needs to be an open market. Anyone who is looking, if you're a health tech expert and you're looking for a tech expert, you should be able to tap resources competitively in an open market. I don't see that yet. I mean, I apologize if it exists, but I don't see a lot of it. And so we must foster this level of collaboration, networking, and ecosystem. This is also to ensure that this category of developers feel the competition and they are equipped to use and support digital health tools effectively. You'll say, if you can still hear me, can you just indicate?
We can hear you.
Okay, so I'm going to round up with just about 2 points for next. Now, the next. Oh, perfect. Thank you. The next one is about creating innovative and sustainable financing models. And I know this is a big deal for a lot of startups because all we hear these days is around, okay, so I have great ideas. I know what the solution is, but there's nobody to fund me. There's nobody to support me in financing and all of that. Many digital health solutions rely on grants or donor funding, which is not always, you know, sustainable. So grants is like somebody giving you early funding, but not. It's almost, you haven't really earned it. And so sometimes we're not sure whether you can sustain it. But strategic partnerships with venture capitalists, with stakes attached, with banks where there are risks, with insurance companies and with government, can unlock new financing models. And the earlier startups realize that it's not about grants. You see, grants is the easy way out. And it's good perhaps maybe for testing and for piloting. But you see, when it comes to really sustaining a solution, you need to take risks. You need to share stakes, and you need to be more serious about sustaining your business. The last of it is promoting inclusive, ethical, and equitable partnerships. And I like the element of culture that the first speaker spoke to. You see, in Africa, we cannot separate culture, the reality of religious beliefs and superstitions from who we are. And the earlier we incorporate it and integrate it in our growth systems, the better. We're not other continents. We're Africa, and we're simply Africa. We have our failures, we have our successes, and we have our potentials. So as digital health scales, we must ensure that it is fit and suitable for everyone, regardless of literacy, illiteracy, especially marginalized groups, women, rural populations, and low-resource communities. Again, that's how to tap the very dense population that we have. Imagine that in Nigeria, we still record about 95% of people living below poverty level, the almighty Nigeria. But that's the reality. So imagine that we're preaching and we're talking to digital prowess for the 5%. That's a very minimal number. So to be able to deliver solutions, we have to think about the masses, the majority, and how it impacts, whether by language, whether by culture, whether by religion, whatever it is. And that needs to be early on incorporated with our thought processes. And lastly, you say it's about building long-term trust-based relationships, understanding from the start that you want to build a sustainable business and doing everything that it takes to ensure that you help build trust and ensure the longevity of collaboration. Trust is essential. It's very vital when dealing with sensitive health data and public services. In conclusion, digital health in Africa is not about isolated success stories. It's about building connected, collaborative ecosystem where solutions are real, where they're impactful, where they're sustainable, and where they're scalable. And when we strengthen these partnerships and expand our networks, like you say, we're being challenged right now to ensure that this network stays and it works, we can then bridge gaps. We can solve bigger problems, and we can solve complex problems. We can unlock investments, and we can co-create the future of healthcare in Africa, doing it together. I thank you all for your esteemed attention. Over.
Thank you, Mories. And we're almost out of time. We're going to go over. And by the way, I put in the chat the link for the after party. And it's also the same link is in the comment section for the event, the LinkedIn event, the webinar on LinkedIn. It's there. So because when the Zoom window closes, you're going to lose the link, but it's going to be there on the LinkedIn event page. Thank you so much, Mories, for joining us. I really appreciate you taking the time out of your hospital stay, or visit, I should say, to talk to us. And I'm wondering, Elvis, are you there?
Thank you, Jose and Antonio. I will not put on camera because of the rain is pouncing and network interruption. So I think I'll just speak fast. Thank you for that opportunity. My name is Elvis, as you heard before, and I'm a health information officer and a researcher. And I've been working in the health sector. To agree with my previous speakers in terms of what they have just said, I concur 100%. What I say is that Africa is actually seeing a rise in digital health infrastructure. And this one is driven by the need to address significant health challenges. And this is to the need to access care, particularly in rural areas. However, their challenges remain, as you've heard from the previous speakers. There are challenges that are there. For example, internet and telecommunication challenges. There is no clear connectivity from rural areas, so that there's a digital divide. And there are also challenges to do with internet access and hindering the implementation of digital solutions. These are key areas. So there is a problem that brings all because of the digital divide. Because you've heard from the previous speakers that there is age gap in Africa. You find the biggest population is actually the young generation. And these are the tech savvy guys. They're the ones to drive this agenda. For you to make sure that you actually reach every corner of Africa, you need to use the young tech. And that's the advantage. So I will not dwell much on the negativities, but I will dwell on the positivity. What is there is actually Africa is ripe for investment in digital space. What we need, as you've heard from the previous speakers, that we need to own our own data. So in the health sector, we don't want to rely on the QC, what we call quality control from the West or Europe. The data should be African, so that you don't come up with conclusion, for example, in specific diagnosis that are not African oriented. We need to be the one to drive the agenda. There are issues to do with the data and the interoperability. Data systems are not really connected, and this has to do with the funding models. You find private, public sector, they're in competition. This is where the challenge comes. If you don't find a means of funding that is actually in tandem with the realities on the ground, there is that competition. And this sustained competition has always been there. That's what is actually bringing the problem, the funding model. You find there's the systems that want to be owned by the government and the systems that want to be owned completely by private. How you bring in these two protagonists together is what will unlock the potential. And then we have issues to do with the with the financing, especially when it comes to health sector. I've seen that you'll find most of the systems that are working are actually in the city centers. In the rural areas, you'll find systems that are not working. And the biggest population, they are in cities. I disagree with Samuel that population are in rural areas. Actually, they have shifted to the city centers. If you look at in East Africa here, you'll find majority of the population are the young and they are in cities. They are not in the rural areas. You'll find the people who are now in rural areas are actually the old people. And you'll find the problems to do with the disease and even pandemics are affecting people in the rural areas. To bring in and bridge this gap, it is where the solution is. So what is the way forward? And because majority of my speakers, other speakers have highlighted what to do. As I said, the infrastructure development should be the key thing. You need to make sure that if it is internet, is all over the African continent. It's not just in the cities. So the investment in mobile networking expansion and internet connectivity are crucial to bridge the digital divide and ensure that wide adoption of digital health solutions is unattainable. Actually, it is a measurable goal that can be achieved. The data interoperability, for example, developing in data interoperability systems that can share information across healthcare settings is very essential for improving care coordination and decision making. And then we need to develop skills, what called the skill set development, investing in digital skills training for healthcare workers and also general public is very essential to ensure that people can effectively use the digital health technologies. Then we'll have to have the policy regulation. For example, you need to make sure that as you give out the data, how is the controls? You need to put out controls. It's not just blanket enrollment. Developing clear policies and regulations that support the safe and ethical use of digital health technologies is very essential. Then we need to have data security and privacy. For example, for my case, I'm talking about the health sector. Ensuring that the patient data is protected and that privacy is maintained is always a key thing because that is the key concern for many people. So they need to have that clear pattern where you will have security, data security and privacy, and you have to hold everybody accountable for what they do. So how you bring in the private sector and public sector to make sure that they are speaking with one voice, it is very important. Samuel talked about earlier on that in Africa, you'll find, for example, in Nigeria, you'll find 70% being in rural area, and in East Africa, you'll find 70% being in urban. The key solution there on implementation is how you bridge in these people so that there is equalization of every sector, that we have a standardized form of approach in terms of implementation and development. Mostly African countries, they have been lacking the funding. The healthcare financing has been a problem. You'll find that is the only problem that has been there, but the people to implement are actually the young people. This digital generation, what we call the digital generation, are the ones to drive this agenda. And they are the ones to change the narrative. Chenayi talked about issues to do with the data being owned by other people. We can, the Chinese have DeepSeek, you have ChatGPT, we can have AI Africa. What is the problem? This is the solution that we are looking at. And we have things like M-Pesa, MTIBA. These are working. The only thing is that how do you harmonize all these processes so that when you are talking from one script. It's not this silo mentality. We actually harmonize all these processes into one body and governance. So governance and implementation, that is the only key thing. Thank you.
Thank you, Elvis. Thank you, Elvis. Antonia, do you want to end the webinar with some closing statements.
That would be lovely. I would first like to say that this webinar, in a way, has proven that it has to be continuous, because there's no way anyone here is going to leave this webinar and join the after party and not have something to take with them to put into action and actualize a digital health Africa network. So closing statements. Thank you so much to all the speakers. There are so many beautiful gems, like the power of community, the need for an integration, for a framework that includes both the young people and the acceptance of the fact that we are different from the Western countries, and so many more beautiful gems, even the acknowledgement of the fact that we do have beautiful things just because we're Africans, and we do have the downsides of being Africans. I just want to iterate that for everyone who is posting what you're doing and your LinkedIn in the chat, you would be able to do that and articulate yourself so much better in the after party, because you get to speak to the camera, you get to speak to people and actually sell what you have, and even make connections enough to build what you're trying to sell, which I'm guessing is yourself. I would say so little time for such a huge topic. So I'm definitely lucky to be here, and I'm sure everyone else who signed up, who might eventually get to watch the videos after, or recordings, or even join in future webinars, would also have something else to take away from this, and hopefully contribute to a digital Africa that is not just digitalized, but is also bias-free and integrates everyone into the system. So yeah.
Thank you. Everybody, you can go, we're going to end the webinar now, but there's a link at the bottom of the chat to the after party. And if for any reason this closes and you lose the link, it's on LinkedIn. It is on the webinar page. There's a link to the after party. You can hit that link, and then everyone's cameras and microphones. Well, you don't have to have your camera and microphone on, but you can, and if you want to speak. We're going to give the audience now a chance to speak and to talk to the speakers, and the speakers to talk to the audience, and for the audience to talk to other people in the audience. So thank you so much, everybody, for coming. I want to thank all the speakers for their insights, their passion, their preparation, their thoughts. And this is just the beginning. So we're going to be doing this again, even after the after party. But thank you so much, everybody. I'm gonna end the event now. Goodbye. See you in the after party.